Hey there, it's Gabrielle Nicolay from SpeechKids and Raising Orchid Kids, where we teach kids how to talk and help parents understand their kids. And if you've been following me on social media, you have heard me goof out about microdosed speech therapy sessions. And so I just wanted to record a longer, less bubbly video about microdose sessions. But you can see that's not going to last very long because I get very excited about this. Here's what I'm talking about when I'm talking about microdosed speech therapy sessions. We do a short daily therapy session every day, 5 days a week, for 10 to 15 minutes. I'm finding that 10 minutes tends to be the sweet spot because in 10 minutes, here's what we can do. We create a greeting ritual. Why is this important? One of the things that we're really trying to get particularly our late talkers, but many of our kids who might be on the autism spectrum, for example, or anybody who's really learning how to use language for interaction is going to want to work on saying hi. The other thing is the word hi itself is made up of some sounds that we really want kids to have. And so if I've got a late talker in front of me, one of the things I want them to be able to do is say the sound and guess what? Hi is a perfect word for that. And so we get to, in this microdosing session, we get to use some really frequent, high traffic, high use words, and we get to practice them over and over. So in my sessions, I do a hi song. So we say hi to all the people in the room. We might say hi to the cars and say hi to the toys and say hi to the computer and say hi to various body parts. It doesn't really matter. What matters is we've got engagement, we've got fun, we've got a ritual. Okay, that's like the first part of the session. The next part of the session includes an activity. Could be a book, could be a play kind of thing. I've done anything from, again, reading a book with a kid, and any number of books are fantastic for that. But I've also done like stacking cups, and we can work on some really key vocabulary for that. What we're always looking for, and this is true of all speech therapy, but when we do a microdose session, we really have to focus. And so that is, that's a little bit of the difference. When we are doing particularly these microdose, but again, in all speech therapy, we want to find the overlap between what are the words that the child needs to be able to say in their day, like what's useful for them, and where are they starting from, and how can we bridge the gap between what they need and what they're able to say. And so that comes in the form of using words that are very useful, very frequent, and then we also want to pick words that have sounds that we're working on, right? So part of the reason I like to explain all of this is because sometimes it looks like we're just having fun. And we are having fun, because if we're not having fun, nobody's learning. But the therapist has also done a fair amount of thinking about what are the pieces, what are the elements, what are the words, what are the sounds, what are the situations that are going to be useful going forward. Okay, so that's like part 1, part 2 of a microdose session. Part 3, guess what, is a bye-bye ritual. And again, greetings and partings, which is how we say it in the jargon, saying hello and goodbye, are really important. It's important not to just like walk away from somebody, right? When you're done talking to them. It's important to have that closure. That's kind of a social norm that we have. And it's not that we're going to like force anybody to sit here and, look me in the eye and say goodbye and all of that. No, we're not going to do that. What we are going to do though is create a really fun ritual where kiddo knows it's time to go and also then knows what to do when it's time to go. So there's so much that can go. This tiny little format, this 10-minute session that I'm talking about, which we do every day, has so many different layers. And that's what makes it really, really magical, is all of these layers are built in. And again, that's true of all good speech therapy, okay? For littles, it's fun, It's engaging, it's useful, and it has practical and doable vocabulary built into it. Okay, that's just kind of basics. The thing that we're adding with these microdose sessions is the frequency. And when we look at the research, and there's some interesting research coming out now about this kind of thing because we've all been online. When you look at the research, frequency and dose matter. They matter a lot, particularly with kids who have apraxia, and for don't go looking at apraxia, but suffice it to say, it is the difficulty making sounds for talking. Okay, not necessarily anything related to how we're thinking, but for kids with apraxia, for kids with autism, which comes with a side order of apraxia sometimes, or for kids who are just having trouble sort of making the connection between what they think and the word that matches what they think. Okay, so there's any number of circumstances that we can be using this format with, but the frequency is the magic here. And so part of the reason I'm so excited about these microdose daily sessions is, number one, we're really leveraging technology. So nobody has to go anywhere, right? And we can get a lot of work done in a very short amount of time. The other thing is that phenomenon, again, borne out by the research, is showing tremendous progress in the kids. So I'm watching children make what looks like basically linear progress, where they're not taking 2 steps back in the 6 intervening days between the time I used to see them once a week and the next time I see them the following week, right? Any number of things can happen in those 6 days. This is 5 days on, 2 days off for rest and recovery. It is turning out to be a really beautiful process. And so that's what happens during a microdose session. That's why we do it this way. And if you're curious about it, I would love to hear from you. Until next time, take care.